Welcome to this fourth in our series of COVID-19 podcasts. The topic of this podcast is mental health and well-being following the COVID-19 outbreak and the lockdown that's followed. I'm delighted to be joined by Dr. Bonnie-Kate Dewar and Dr. Jessica Fish, both who form part of our scientific advisory panel. So I'm especially delighted to welcome them to this particular podcast. Our scientific advisory panel consists of experts in a wide range of disciplines, from neurology and immunology through to psychology, neuropsychiatry. But in the case of Jess and Bonnie-Kate, their specialties are psychology and neuropsychology. So welcome to you both.
Good to see you, Ava.
Good, thank you. Bonnie-Kate and Jess, would you like to say a few words about who you are, what you do, and any work that you've been involved in relating to the current COVID-19 outbreak? Perhaps Jess, if you want to go first.
Sure. So I'm a clinical psychologist and I work 4 days a week as a lecturer on the clinical psychology training programme at the University of Glasgow. So the team up here in Glasgow have been working really hard to try to adapt the training programme so that we can continue to provide good training for clinical psychologists so that they can hopefully graduate on time and then go into the workforce in a planned way, which is obviously really important at the moment because of the likely mental health impacts of the current situation. And our trainees also, they are students at the university, but they also are continually on placement at least 3 days a week, working in mental health services. So there's been lots of work going in to adapt that. And I also work 1 day a week for St George's Hospital in London, where I have a research role in the Department of Clinical Neuropsychology and Clinical Health Psychology. And my colleagues there are obviously working, a lot of them on the front line at the hospitals that form part of St George's Trust, trying to maintain some of the essential services, and also doing really impressive new work in developing services for staff support. And I can't really, unfortunately, contribute directly to that work, but my role there is more involved in disseminating that great clinical work that's going on, so with our ongoing research projects.
Oh, thanks, Joss. Bonnie-Kate?
Well, I'm a clinical neuropsychologist and I'm in private practice. I've got rooms in central London. So as yet, I haven't been directly involved in any sort of work or clinical work or research around the COVID pandemic. But what I am looking carefully at is that the International Neuropsychology Society is setting up a special interest group. So this idea of having sort of an international response to how to actually, diagnose and then rehabilitate and support people who have these sort of, neurological or neuropsychological consequences following COVID-19. And then in the UK, with the Society and with Jess and other colleagues, looking at how we can actually then also sort of provide support, information, signposting for people who unfortunately may have, the longer term consequences of this infection.
Have either of you worked with many encephalitis patients, and what did that work involve?
So, I think we've both worked with lots of people with encephalitis, and where I started speaking first, but there might be some overlap in kind of what Bonnie-Kate and I have to say here. But so yeah, I've done lots of work with people who have been affected by encephalitis, either themselves or a family member, mainly in a rehabilitation context, where we would start out by conducting a really thorough assessment, trying to see how the consequences of the encephalitis have impacted that person, the way their thinking skills, the way they feel about themselves, and how it's impacted on the kind of roles that are important to them, and how it's impacted on families more broadly and work, things like that. And some of the particularly sort of specialist work that I've been involved with has been helping people to develop really good cognitive strategies to compensate for particularly the memory difficulties that can result from encephalitis. So that's the kind of main summary.
Okay, and Jess, you're right. I mean, both as in our clinical roles, we've done similar work with people with encephalitis. So, I mean, in the past, I've been very fortunate to work with the MRC in Cambridge, where Jess, we first met. So I had the great pleasure and privilege of working with Professor Barbara Wilson, where we were doing some research into memory rehabilitation. And I did work with a specific group of people with encephalitis. From there, I've also done some research into how to specifically train people using compensatory memory supports following encephalitis, and that very much informs sort of the ongoing clinical practice, where I see individuals for not just assessment, but then rehabilitation tailored to what their specific needs are. And I think following from that, and Jess, I'm sure you would agree, is looking at how someone adjusts to the cognitive and behavioural and emotional changes following encephalitis to sort of rebuild or sort of reestablish the sense of identity. And I think, it's a very individual, it's very rewarding work. And I think it's allowed, personally to be very creative in what you can offer, whether working with someone who has had a loss of their semantic memory, their memory of people, the memory of faces, and the memory of loss of remote memories in their past, and how to really rebuild that to sort of, help them progress and better understand who they are now.
Well, I mean, I've worked with you both for quite some time now. I know that you do amazing work, and I know how very grateful the many patients that have gone through each of your practices are. We're obviously talking during an unprecedented moment in our lifetimes. How have you and your colleagues been coping?
Well, I mean, I think I've been coping mainly by trying to practice what I preach when helping people to develop cognitive strategies. I've been planning everything in much more detail than I usually do. So I've got a very long to-do list for work, and when I'm sitting here at this computer, I go by that to-do list, and when I'm sitting in a different part of my living room or elsewhere in my flat, I follow a different sort of to-do list. What I'm trying to get across by saying that is thinking about, I'm trying to think about how kind of anxiety provoking and how different this period of time is, and trying to make sure that I've got that I just keep well and make sure that although I've got lots of work to do, that I'm not overly focusing on that, and I'm doing plenty of things that I enjoy and that keep me connected with my friends and family and things like that. And I think most of the people that I both work with and in my sort of broader social circles are taking the same sort of approach, just trying to take each day as it comes and control what we can and not be too preoccupied with the things that we don't have control over.
Again, fairly similar, but I think, to acknowledge that first initial sort of flurry of activity that was very much anxiety driven, both on a personal and professional level, about sort of, we'll talk about this in a moment, the rapid change in how I actually run my clinical practice, what I'm able to offer. Fueled by sort of, personal financial concerns. Will I be able to sort of, buy food to sort of feed the family? So almost spurring an overactive kind of week. But then also very much the real anxiety of, the health of my family and friends. Will I, be at risk for other people? Those concerns. So I think that sort of I did have a couple of weeks where it was extremely stressful, extremely anxious. But I think in time, taking that structured approach, beginning to sort of recognise, what actually am I worried about and how much control I have over that. And from there, it's very much about sort of finding a balance and finding what helps. So exercise, cycling, meditation, hugs, chocolate, these sorts of things, and connecting. And I think that that's sort of both personally with family and friends, but professionally as well. In some ways, I've had almost more contact with colleagues, via Zoom, sort of, peer support meetings, both clinically and some of the medical legal work I do. And it's been really useful, just even if the conversation sort of tends to the personal sometimes, then gets back on track with work. It's really been useful to connect to maintain those connections. And I think actually strengthen some of those connections with colleagues.
Well, I love that. Hugs and chocolates, right? And we're going to come back to the cycling for sure. How have your working days changed during the COVID-19 pandemic?
I think I feel like I'm in quite an unusual position in some ways, in that my working days haven't changed very much, except for the format in which I've been working. So I sit here and work from my home computer and do all the things that I would have done in my office otherwise. But the sort of tea and coffee breaks are probably more frequent, but chat. So I've been more productive, I think, in some ways. I think this is similar for a lot of my university colleagues, although it's more complicated for people who've got caring responsibilities and things, obviously. But I think life has changed a lot more for the clinical colleagues that I have at St George's.
Thank you. Bonnie Kate.
Okay. So I think that work has in some ways changed. I mean, as my running my own business, I did have days working at home, and I needed those almost as a buffer with the clinical face-to-face work. But it's been really interesting, the challenge to switch from face-to-face therapy work, rehabilitation sessions, and importantly, clinical psychometric assessments, to doing that from face-to-face to what we can do via Zoom, via Skype, via phone. And I think it's been really, interesting to see the creativity and the creative problem solving that clinicians colleagues across the world have said, okay, this is the situation we're in, what can we do and how do we do it? So I have moved to video tele-neuropsychology for both support sessions, rehab sessions and assessments, which is challenging and extremely exhausting. Just, I think, learning the new way of doing things, and something about the technology, but yet I'm confident that it works. I mean, there were lots of webinars, I've looked at the research, so it's not just winging it, it's actually sort of going forward with sort of, a scientific basis for this. There's now research using this opportunity, dare I say that, as an opportunity for research about how we can deliver neuropsychological services in this format. But I think that one thing that's really changed about my current working day is the challenge of homeschooling. So I'm sitting here having thrown technology and screens at my two lovely children aged 10 and 12, extra snacks, and it's really hard because, it's just, again, level upon level of responsibility and headspace and focus. And, there are days where, not much gets done work-wise, but, the kids are sort of, chipping away with their education. So it's challenging, being very organised and very kind to myself, and sometimes not beating myself up if I don't have a very productive day has been helpful. We'll get back to that kind of theme as we speak on.
Right. Yeah, you're absolutely right. We're going to come on to, more about mental health and well-being, and some top tips for people that are watching this. Dr. Benedict Michael and I were talking last week about how the public support for the NHS has been particularly comforting and inspiring to him personally and to his colleagues. Have there been any moments which have stood out for you?
Yeah, I mean, I think Clap for Carers is the obvious one. I know the first week I was on the phone to my aunt and she said, are you going to do it? And I thought, I don't know. I thought I would go out and see what happened. And then I went out and I saw that there were lots of people there, but nobody was doing anything. And I really surprised myself by starting clapping. And then it was amazing. And then now it just, I haven't lived here for very long. And I'm looking over there because that's where I do my clapping, out on the little balcony. And it's fostered a really nice sense of, I suppose, indirect sense of community. I think it's a nice part of a routine as well, that it's happening weekly. And it just really, I think, demonstrates the really, really strong kind of care and respect and love and how much people value the NHS. And speaking from here in Britain, it's not something that we're necessarily known for, I think, being sort of very open about the things that we think are wonderful. It doesn't fit in with a sort of stiff upper lip stereotype. So I have really loved seeing that and being part of it.
Bonnie Kay?
I agree. Clap for Carers is quite special. You can see sometimes on social media, people may be, questioning it, but I think that sort of when that wave comes through, of sort of the applause, and we're having bells, vuvuzelas, fireworks. It's quite something. And I mean, there is that community cohesion, but I think that people do recognise what the NHS workers are doing for us, and what they're doing for this country, and I guess health workers across the world. But I think the other thing that's really stood out for me is, sadly, because we are, here in the UK and across the world again, the health workers who are dying, and then to see online the tributes to those people who have lost their lives has been incredibly moving. That sort of, that their sacrifice and their is acknowledged in a very, very moving way. But I think also sort of, the way that various industries are coming together to sort of actually contribute and sort of, provide, in this case of need, whether it's PPE or masks or, calls for something, whether it's walkie-talkies, anything, things that come through that way.
Well, we said we were going to come on to talk about mental health and well-being, and hopefully to offer some top tips and some advice to people that are watching this. We're now entering our 6th week of lockdown, social distancing, and for some, of course, social isolation. Has anything struck you about how the world or various countries have been coping?
Yes, I think because of the nature of how the pandemic progressed, we did get to learn about how other countries were responding to the big social changes that have been brought about. And I suppose part of me was seeing particularly the Mediterranean countries and their responses, and seeing how socially connected people were managing to sort of continue to be. I sort of was a bit, I wasn't sure that the UK would be able to follow in the same steps, really, and I kind of I did wonder if we might not have similar videos of events like such as Clap for Carers. So I feel sort of, I don't usually say this, but I feel quite sort of proud of us as a nation with no other connotations for being able to do that, to be open about our emotional experiences, and also talking to people, to each other, about our mental well-being isn't something that a lot of people find easy. And I've been really impressed and think it's really important that people are speaking to each other about the kind of social and mental health impacts.
Yeah, I completely agree with you. And, you know, I travel a lot, as you both know, or normally when we're not in a lockdown because of a global pandemic. And, you know, every time generally that I travel abroad, I come back so grateful for the NHS and for our health and social care industries. And you know, I think we forget sometimes how very fortunate we are. Bonnie Kate.
I think, I mean, I agree. It's that sort of idea that, you know, people are keeping an eye out for each other. And I think that it's I think most notable sort of at a really sort of community level. And this might be whether, you know, you check on your neighbours. I think we all know our neighbours a little bit more now. You know, what do they need? Do they, you know, I'm getting a grocery delivery. Is there anything you need? That sort of thing. And then it sort of spreads up, whether it's sort of, you know, providing for a local food bank or looking, you know, at the huge call out for sort of the huge response for NHS volunteers, for example. I just get this sort of sense that people are sort of, you know, keeping an eye out for each other and maybe thinking of people a little, you know, close to them a little bit more, who's in the neighbourhood. I've also been really struck by how creative people are, and sort of, you know, driven by this need to have joy and to have and happiness and to connect with other people. So we've all seen sort of the, you know, the wonderful, whether it's a TikTok meme or sort of, you know, an online choir or a family singing something from Les Mis. It's just been really, you know, amazing the creative sort of, you know, output that's being created. But I think the other thing that I'm also noticing is that, you know, particularly here in the UK, as we're sort of, you know, beginning to consider what it's going to be like to move out of lockdown, is that, you know, I think that people are very anxious and very worried still, and that can sometimes translate to suspicion or a bit of frustration to people as you walk past the street, when we're told to sort of keep our 2 meters. But when you see someone approaching you, you might sort of thank them for sort of standing back as you pass. But there's still that anxiety of actually like, but you know, or suspicion, don't get too close because I'm not sure, you know, what your health is like or what the situation is. And I think it's going to be really interesting to see how we move from that, you must stay away from people, back to what is a very natural sort of, you know, state for us to be close to other people. It's going to be interesting.
Yeah, I can't wait to get on the tube again in London and just see how people deal with that, right?
Yeah, I can hold off getting on the tube for a bit longer.
Is there any current research being undertaken looking at the impact of social distancing and lockdown on the general public at the moment?
Yes, I think there's loads. Actually, I mean, I found it really helpful to be keeping abreast of all of this research that's been generated incredibly quickly through social media. So there was a big paper published in the Lancet Psychiatry just, I think, last week, reporting results from surveys of, I think, more than 2,000 people with mental health conditions and from the general population to try and establish what the research priorities are from a mental health and wellbeing perspective. So that, I think, will be very influential then in later funding schemes that are set up, which will be obviously required in order to do good high quality research in this area. And also I've been alerted to lots of different research studies, possibly, well, some of them quite large and some of them quite small, that you can actually participate in very easily online. So I'm taking part in one study that sends a link through every week via email and asks you to take one day from one working day or weekday from the last week and kind of say how much time you spent in various different activities, and then fill in various questionnaires about your kind of mood and anxiety and well-being more broadly, and about what your perceptions are about kind of the country and the world and the government's ability to cope with the pandemic. And so that's quite an interesting experience, I think, really. It helps me to kind of reflect on how things are going for me personally, but I quite like doing it because it feels like I'm making a bit of a contribution to the research efforts. I think it's quite a good way that anybody can participate really in these studies.
Oh, that sounds great. Well, as we all know, coronavirus has affected all aspects of our lives, and the constant news about the pandemic can feel never-ending, certainly for me sometimes. Not only is it impacting on our physical health, but it's also taking its toll, I think, on some people's mental health. Staying at home, social distancing and self-isolating, of course, are crucial in stopping the spread of COVID-19, but they do affect us psychologically. And I wanted to ask you, why does that happen? And what are the types of things that people might notice that might suggest that they're experiencing stress or anxiety during this time, Bonnie Kate?
Okay. I mean, I think that sort of, we've all been thrust into these circumstances which seem to be beyond our control, and it's changed significantly so many different facets of our life. So, many of us are indeed living with a lot of uncertainty about sort of whether it be our health, our work, our finances, relationships, so many changes on such a significant level. So I think that sort of, I think what's also interesting to notice is that in the midst of this, here we're being thrust into this really stressful situation, and yet many of the means or our usual techniques for managing stress, whether we're aware of that or not, have been taken away from us. Whether we're sort of limited in sort of the journeys we can make outdoors, limited in who we can actually see, so we're stressed, but yet we may not be able to know what to do with that. But I think that's, and I think that there's, it has been suggested as well that we're almost grieving for the loss of our past lives on some level. And, I think that it is going to be really interesting to look to the research that's coming out of this and the social isolation and the social distancing to sort of see how we can manage things going forward. Because I think that there's my delivery. I think that inherently we are social creatures, and to have that connection with someone being taken away quite rapidly and sort of we don't know when that opportunity to connect is going to return, I think is inherently stressful for us. Even those who do appreciate their own company or who tend towards being more introverted. So I think that again, many of us might be able to recognize some of these sort of signs and symptoms of being stressed and anxious. We might be demonstrating these across the hour, across the day, across the weeks. So we might be more irritable, snappy, tend to sort of fly off the handle and be really intolerant of anything that's interrupts us, or when things aren't going our way. Increased arguments, yelling at those we love and those who are suddenly within our the confines of our environment, where we may not be able to get away from these situations or these people if we're finding them irritating or more annoying because our levels of stress are already heightened. I mean, I think that people may experience difficulty sleeping. They may also then conversely feel more tired over and above any difficulty sleeping. People might find that they are quite lethargic and have no energy, or they might actually be quite restless and unable to sit still. And I think importantly, along with heightened stress and anxiety, many people might be finding it very hard to concentrate and hard to focus and feel quite absent-minded. It's been interesting to hear just these anecdotal reports of people who have maybe more time or, less, more opportunity within their day to read a book, but yet are unable to sort of pick up and really sort of engage in something like that. And so, if we have difficulty focusing, people might also find that it's harder to remember things. And I think that these are sort of, consequences of increased stress and anxiety.
We didn't talk about this when we chatted beforehand, but I just wondered what you thought. Do you think that those things can be magnified for people who are post-encephalitis?
I mean, I would say yes, because, it's almost, whether, say, if someone has cognitive changes following encephalitis, where they may have a tendency, because of the long-term effects, to be more easily overwhelmed by information. So it might be harder for them to actually sort of almost process information anyway. And then all of this barrage of news, or the intrusive worrying thoughts about family, health, friends that we've been talking about, almost sort of makes it just too much of an information overload. Again, the problems with focus, the problems with, energy and fatigue, all have this knock-on effect. So, I mean, again, we might come back to this later. If an individual following encephalitis pre-COVID-19 had these difficulties, all the more reason now to rely on sort of, whether it's memory strategies, organizational strategies, because your already vulnerable memory, thinking, concentration systems are going to be just so much more under threat and under pressure because of the situation you find yourself in.
I'm guessing some people, actually just might find reassurance in your words there, knowing that actually, in these abnormal times, that would be a normal response. But as you alluded to, not only is the threat of a new virus scary, many people are facing many of the things that you described, these stressful life challenges. Lots of people who were working in pubs and restaurants or who are self-employed have lost their jobs or had their incomes cut, for example. I think social distancing and self-isolation means avoiding, as you said, seeing family and friends. And many people, of course, are worried about vulnerable loved ones that they're not able to see in person. And of course, for the millions of people for whom it's been recommended that they stay indoors entirely for 3 months as part of the shielding initiatives around the world, restrictions can feel even more extreme. What type of behaviours, activities and ways of being can people adopt to strengthen and improve their mental health and well-being at this time?
Well, I think there's lots in there, so I'll try, and please do prompt me if I kind of go off track or try or omit something that's important. But I think hearing what you've said, it's really important to think about what our needs are. And if you're in a situation where you have got a lot of money worries, or you're not sure if you can pay your rent, etc., then it's really important to obviously try and make sure that you can access all of the support that is available from various government and other initiatives, because that is a really very genuine and realistic concern and cause for anxiety. And if you don't have those things sorted out, it's going to be much more difficult to keep feeling kind of mentally well. And doing some mindfulness meditation isn't necessarily going to help you overcome those really serious practical problems. So I think that's the sort of first thing. And I think then the other strategies that I would think about and sort of approaches to managing this really difficult situation really stem from the kind of the causes that Bonnie Kate was describing. So I think everybody listening to this will be aware that a lot of us are feeling much more socially disconnected than we usually would do. But there's been a huge surge of kind of interest and use in alternative ways of keeping socially connected. This idea about being physically distanced rather than socially distanced. So, this podcast that we're on now is one example of that. I feel like I've got lots better at using, well, I hope I have, technologies like this in meetings and feeling more sort of comfortable with it. And that works well, not just for work, but also for social relationships. So I know that I have a group of friends from school, and I've had several video chats with them over the last kind of month, and we've literally never done that before. So, but it's been really lovely to kind of reestablish some of those connections. And I think that there are other lots of really creative ways. I think Bonnie Kate was alluding to this before, or mentioned this before as well, things like kind of maybe more novel uses of social media and technology to keep socially connected, things like these online choirs, and I've heard about people moving book groups that they're normally in online, and people who've kind of moved away from, like, maybe used to be in a group but then dropped out because they moved away, have gone back into some of those groups, which is a really nice thing. I watched a film online with my aunt and uncle in Devon last week using this really cool app, which sounds funny because it's, it's quite a solitary thing in some ways to watch a film, but it was really nice to see them on the little sort of panel at the bottom of the screen, and then we had a bit of a chat online afterwards. So there are all of these new sort of options for keeping socially connected, and I think it's really important to prioritise that, because like Bonnie Kate said, we're social creatures, and also a lot of kind of who we are, our sense of identity is bound up in the groups that we're part of. So I think taking every sort of opportunity to maintain those links is really, really important. It's also important to try and keep a routine if you can, so to really focus on making sure that you get enough sleep and that you're eating well, getting exercise, going out when you can. And I think, as I mentioned, and definitely, as Bonnie Kate mentioned, if you use memory strategies and sort of strategies to help you plan and organise your day, really, really important, even if your days look quite different, to keep using those strategies. And maybe even if you don't use those strategies usually, then it's quite a good thing to do to start using them, like I have, or I've used them more intensively than I used to, because there's so much uncertainty, and it's so easy to kind of get caught up in reading the news endlessly, or listening to the radio and seeking out more and more information. A lot of time can go by, and then you kind of realize that actually you're maybe not in the right place to go to sleep, you're too sort of wound up. So really trying to be planful about what we do, the activities that fill our days, in order to sort of keep a good balance of activities. And I'd say as well, it's important to try to be sort of curious about this situation and its impact on yourself. So not just about the sort of broader picture, but thinking about, noticing if you start to feel anxious, trying to identify why that might be, trying not to sort of worry too much about it, but take a bit of a kind of outside perspective and think, what's the cause of this? Like, is there anything that I might be able to do differently to feel to feel a bit better, to kind of let go of some of this anxiety? Would it help to speak to somebody else? What might they say about how I'm feeling? And just keep an open mind, and thinking about, if you, for example, have a really bad day and you don't achieve much, or you kind of argue with the people that you're locked down with, then trying to not let that impact too much on the following days, but think, well, maybe I'll try and learn from that and try and do things a bit differently in the future. So kind of taking a bit of an experimental approach, because nobody knows the sort of right answers for each specific person. It's about thinking about the kind of general principles that we know are important in maintaining well-being and in causing distress, and trying to sort of tweak those things to our advantage.
That sounds great. Well, what are your thoughts, Bonnie Kate?
Well, I agree with the strategies that Jess has suggested. I think she's been, quite a comprehensive description of what is possible to do. But I would also emphasise just the need to be, I think Jess alluded to this, the need to be kind to yourself. This is a really difficult situation. It's very challenging, and there will be days and times or hours when it's a struggle. And so I, would, as much as possible, and I appreciate it may be easier said than done, but to not be too harsh on yourself if there are days when you struggle to get anything done, when you have an argument or fall out with your partner or your son or whoever it might be. But I think that it is also important to recognise if that struggle continues, and to actually then sort of look to avenues for professional help. As we've both been saying, many psychologists, therapists and mental health professionals are now working online, so that those services, that professional support, will be available should you need it. Just I guess following on from some of the strategies that Jess mentioned, this idea of identifying what you do enjoy, what you are able to do within the confines of this situation. And, you know, almost sort of have them as a either plan when you're going to do them throughout your day, or have a list or sort of, you know, a pool of those activities or resources, so that if you are having a particularly bad day, if you are feeling particularly stressed or anxious, that's when you can turn to them. Almost, you know, in case of stress, break glass and pat the dog, or, you know, hug the kids, or turn some music up and sort of, you know, dance to your favorite tune, that sort of thing. So just to sort of, it's not going to change the threats and the situations in the long term, but just to maybe release some of that pressure actually at that time in the moment. You know, similarly, you know, and it might be helpful for some people as, you know, that idea of just being sort of saying about being curious and sort of stopping to think. Some people might find it's useful to even write down what their worries are and to sort of get it out in that way, and then return to that at a later time when maybe that emotional sting has been taken out of the situation, to then adopt maybe a problem-solving approach to what those worries are, whether that be by yourself, to reach out with friends or family, or again, you know, to seek some sort of professional support. I think that all of these things can be helpful. You know, I think that things like, or activities, I should say, like exercise, can be also really useful. And people do find that, you know, meditation, mindfulness meditation can also be useful. And, you know, with regular practice, even in a very difficult situation, allowing that sort of, you know, literal headspace can be really helpful.
Oh, that sounds great. Thank you. Jess mentioned this when she was talking, and I think I agree. You know, it can be really hard to escape this constant, well, what can feel like a constant barrage of bad news in the media, which of course can add to people's feelings of stress and anxiety. In addition, we've all had to migrate, as you spoke about, Bonnie Kate, we've all had to migrate to spend a lot more time online, and some of that will undoubtedly be on social media. Do you have any top tips for people really about managing themselves online to help them reduce any burden or anxieties that they might be feeling?
I think that, you know, I agree, you know, it is really important to ration the amount of time that you spend online, and even pre COVID-19, but I think even more so because there is this sort of constant flood of bad news and distractions. And again, we many of us, most of us, don't have access to our usual forms of entertainment and recreation, but we've got a tablet in front of us and off we go. But I think that you know, it is important for our mental health to be aware of the negative impact of social, not just social media, of being online, and to just allow time to stop and think about how it makes us feel. How does that then make us behave? So it might be helpful to allocate certain times of the day. For example, if you want to keep up to date with the news, select a certain time of the day when you're going to do that. And I would recommend, and this is anecdotal personal experience, you don't do that just as you're about to go to sleep. Because, you know, if we're going to be sort of scrolling through or checking the news, that can then stimulate sort of lots of negative thoughts, which then can heighten our arousal and make us anxious and cause sleeping difficulties, which can have knock-on effect from there. So, you know, again, the usual guidelines apply for, you know, online use, not just sort of allocating, okay, I'm going to read the news in the middle of the day, but be aware of sort of, you know, scrolling through your social media into the early hours of the morning. That idea of sort of, you know, reducing your use of tablets and phone with not just the blue light, but it's this stimulating news that you're getting through those devices, which can have the knock-on effect of increasing your anxiety and causing a negative impact on sleep. You know, we spoke before about, you know, I think the real importance of finding those activities that give you enjoyment and that sort of counteract the stress that distract you. And I think that this is, you know, finding activities that are not technology based and doing more of those. So whether it's, you know, listening to music, cooking, a board game, reading, you know, exercise, these sorts of things. And I'm well, not happy to say, but perplexed. But I think that there's almost in Australia at the moment sort of a jigsaw competition. Everyone seems to be doing jigsaws. So that idea, and I love the idea of doing a jigsaw if I could find some space, because I think it's, again, quite a meditative but challenging and rewarding thing to do. But it's finding other activities that are offline and just knowing when it's time to step offline and do something else.
I love a jigsaw. Jess, have you got anything you want to add to that?
I'd add that I put a jigsaw on my birthday list last week, so I'm expecting to have one arrive anytime. And also, I'm afraid that there must have been some delivery for me as well, because I've been distracted in what I'm sure was Bonnie Kate's very comprehensive answer by my phone ringing and both sets of doorbells ringing. So I think I will not add anything else onto that and trust that you've covered it well.
Just one thing, just sort of, dare I say, that I think we'd spoken about prior to today, is that whilst, I think that we spoke, and I spoke as well before about the creativity that's coming out online. So whilst, it is very easy to slip into sort of the bad news stories, I think, there is some really good content out there online. And I think it's a big call out to John Krasinski in Some Good News, which is just, I think as you mentioned, the challenge to not happy cry at least once, if not twice, during each episode. It's quite special.
Where can people find that? Is that on YouTube? Or?
It's on YouTube, and it's Some Good News. So he's an actor, actor and director, and it's really worthwhile. He basically, I think my understanding is he started off by saying, look, there's lots of bad news out there. Send me your good news stories. And people across the world are flooding in, and he's got this wonderful sort of compilation of that.
Well, that sounds amazing. I'm going to check that out. Certainly, we've seen demand for our services skyrocket in the early weeks of COVID-19. My team were reporting 113% increased demand on our support service, which is our primary service for people that have been affected by the condition and family members. So that's been up and down, but I'm told now the mean average every week is still a huge 67% average increase for us. We've had calls from people who are struggling with feelings of isolation, and I think the team have put together quite a number of resources that I just wanted to share for a second for people. So they've got weekly virtual gatherings on which people can access via most of our social media, and if people aren't sure, they can still give the team a ring or chat to us online, and we can tell them how to join in with those things. And they've also reintroduced our award-winning Brain Walk app that we normally reserve for World Encephalitis Day, but the team have relaunched it so that people can be getting active but also communicating with each other in the forum there. So that's another opportunity for people to connect. And they've also launched a new community support forum for peer-to-peer support called Health Unlocked. So if people want to explore any of those kind of innovative digital things that the Encephalitis Society have done, they can do that by going to our website, which is encephalitis.info. But one thing we were wondering about, I think we're expecting that the strain on carers will increase as well, mainly because they haven't got the respite that they normally would have access to. So is there anything that you'd suggest to carers who are in a situation where they're living with someone who needs support in that kind of caring environment?
Yeah, certainly. I suppose first to say how really good it is to hear about all of the services that you're offering at the Encephalitis Society, and always available to people affected themselves and families. And to say that it's just it must be such a difficult situation. It is really challenging for carers at this particular time, without that same respite, with interruptions for services, or not being able to go out and do the things that we usually can. So it's to acknowledge that it is a difficult situation, and there's certainly nothing sort of unusual or to be worried about if you as a carer are feeling like you're really struggling, and like it's we'll be expecting people to feel more gloomy more often, worried, feeling more frustrated. These are all quite normal reactions to have to this really difficult situation. And I think it's a little bit of a cliche in some respects, and it's really certainly much more difficult to do than to say. But the old adage about needing to put on your own oxygen mask before trying to help others is really, really important. If you yourself are, burned out and at the end of your tether, you're not going to be able to provide the support in the way that you would want to be doing. So trying to put yourself first and to make sure that your sort of needs are met, and that you do carve out time for yourself in whatever way that might be. And it might be in a reduced way relative to normal, but it is really important to try to prioritize those things and to make use of the supports that are available. I mean, hopefully it won't be too much longer before some of the the regular services come back into operation. And I would hope that those things would be prioritized, whilst containing kind of spread of the disease. So you've really nicely outlined the supports that are available from the society. There are also, there's Carers UK that I think have a lot of resources as well, and we can maybe put a link to some of their guidance with this. That's specific to that caring role. And then also I suppose to say that though things are really, really different, there are many NHS services are continuing to operate. So if there is a service that you are linked in with, don't necessarily assume that they're not running or able to provide any support. It might be the case that they're offering remote support, or that it's worth making contact with them to ask what's available to you. And I suppose keeping in mind that knowledge that this will end. It feels like it's going on for a long time, but there are obviously signs that the situation is improving, and due to the work of the amazing scientists that are working to develop treatments and vaccine things, that this won't go on forever. And I suppose the same advice that we were talking about in relation to maintaining well-being, like making sure that your kind of routine is maintained, and that you're keeping in touch with the people who can provide you even just emotional support, are really important for carers as well.
That sounds great. Of course, I'm mindful also as well that some of our viewers might be professionals, they might be frontline staff. Have you got any advice for them? What can they do to cope with the stresses and trauma of frontline work?
Well, I mean, I think that we can agree that frontline staff will be experiencing a unique set of stresses, feelings of grief, burning out, worrying about their own health, feeling overwhelmed, feeling quite hopeless in sort of the individuals they're taking care of. And I think it's also really important to consider that many of these frontline staff may have not just these needs arising from the acute stress, but maybe we could anticipate psychological needs further down the track as sort of this, as literally as this wave passes. So I think that sort of, some of the strategies, well, a lot of the strategies we've talked about today can also apply to people who are working as frontline staff. But I understand, for example, within the NHS in the UK, that many of the teams will have details of the resources that are available for their staff. So that, if you are feeling overwhelmed or stressed, go to your team manager, the social work department, psychology, to find out sort of what is available. And this might be in the form of an individual who can provide you with space to talk or support. And I understand that there are other resources are available, whether this be via telephone support. There are many apps that are available. So, if people are sort of exhausted and time pressured, it may be something that there are different ways to actually access that support at that time. But I think that also sort of, keep an awareness of sort of, what your longer term supports might need. So, I think that it's sort of, again, taking care of yourself, but, and asking for help, because it's my understanding that there are sort of some good resources that are there to help people who are taking care of our loved ones.
Mm. So I think what I take away from that a bit is that no matter where staff might be in the world, that they must reach out and take advantages of the many things that are available to them from their varying healthcare sector backgrounds, and that I guess some of that might also be from some of the organisations that people are registered with, like the psychological societies or occupational therapists.
Royal College of Nurses, for example.
Right.
These sorts of things, yeah.
Yeah, no, agreed. Well, we're coming towards a little bit towards the end of our podcast. So just want to ask you both, I think, put you on the spot. What would your top 3 recommendations then be to people generally for them to maintain their mental health and well-being during this time?
So I think, I'll probably choose 3 and then decide, oh no, that one should have been number 4 and I've missed one, but I'll try and pin my thoughts down. So I think the most important one is to stay socially connected. I'd say try and stay or be active, get out for your daily exercise when you can, enjoy the springing, and be creative. If there are things that you can't do that you usually would to help yourself feel better, then think about ways that you can get similar effects from slightly different approaches.
I would say, similar, to stay active and keep moving in whatever shape or form that is for you, to connect with others, to say hello in the street, or to sort of, get on the phone, or, Zoom sessions. But I think what's really important is to be kind to yourself. This is a really difficult situation. Yeah, be kind.
That sounds great. And I forgot to mention earlier as well for people that the Brain Walk app, as much as its title suggests it's all about walking, and you both mentioned about staying active. We also, the team were at great pains to include lots of games that people can play on there. So they were able to, we can embrace people as well who find it difficult to stay active. So the games actually allow them to convert their game scores to footsteps, so they can still participate along with everybody else in marathons or 10Ks or whatever it might be that people are up to on the app. So again, I don't want people listening to the podcast to think that, if they can't run a 10K, they can't get involved. They absolutely can get involved with the app. But you've both, when we were talking earlier, you've both recommended a range of resources for people who might like to find out more about some of what we've been talking about. And we're going to add this list to the podcast in the text element of that. So thank you both for that. But Bonnie Kate, I can't let you go without asking about your mammoth fundraising event, cycling from London to Brighton in support of the Encephalitis Society on September the 13th. First of all, thank you very much from me and all of the team. Sounds like a very tough challenge, but I take it you've been putting in the practice?
Well, I've started, I dare say. I've got a few months yet to reach peak fitness and figure out actually how many kilometres 55 miles actually is. But yeah, I mean, cycling at the moment is my lifeline. It's really good to get out and just have a little taste of freedom as I poodle around the neighbourhood. And I live in North London, so I've got some pretty severe hills to practice my journey into Brighton. So yeah, I'm looking forward to it. It's a great challenge for me, and it's supporting your fantastic charity.
Oh, well, thank you so much. I mean, now more than ever, we're grateful. We've lost over 80 fundraising events, which is around about a third of our income due to the COVID pandemic. And that's a big hit, I guess, for us to take. So we're ever more grateful for people signing up to things like this at the moment. But where can people go to support your fundraiser, Bonnie Kate?
Well, I've set up a Just Giving page. So if you go to, if you Google Just Giving, it'll come up. And then if you can either plug in my name, which is Bonnie Kate Dewar, or Encephalitis Society, and then it will come up with my picture of my lovely bike saying Cycling for Encephalitis Society. And please give whatever you're able to do.
No, thank you so much. For people that want to support us as well, you can simply go to encephalitis.info/donate, or if you fancy being a hero or heroine like Bonnie Kate, then you can get involved with fundraising that's taking place that you can do from your own homes. You don't have to be out and about and doing things. So just visit, in that case, encephalitis.info/do-your-own-thing. Rather funky name, obviously, by my team. But as we bring this podcast to a close, is there anything else that either of you would like to say?
Yeah, I'd just like to send my very best wishes, I suppose, to the people watching this podcast. will all struggle on different days and different ways in this really difficult time. And so I send you my very best wishes. And would just hope you're able to look after yourselves as well as you can. And I'd like to say thank you to Ava and her amazing team for all of the brilliant work that they're doing for this fantastic society. Well done.
Thank you.
I mean, I can just echo those thanks, Ava, for sort of, I know I appreciate that this is a really hard time for the charity, and yet so important, particularly at this time. So, we wish you all the best and good health and the resilience to get through this. And really it is just sort of, we're all opening our emails or our phone calls or our messages with, I hope you're well. And I hope the people who are watching this, that you stay well and you stay healthy, both you and your loved ones.
Oh, thank you so much, guys. Look, we've covered an awful lot of questions there. We're deeply grateful to you both for taking the time out to do this podcast with us. On behalf of all of our members, please accept our grateful thanks for all that you do, along with the rest of our scientific advisors. We also want to finish by reminding any viewers that the Encephalitis Society services currently remain unaffected by this recent outbreak. So if people need any kind of support or information, then our teams remain at your service. Go to encephalitis.info for contact details or to chat online. And most of all, as Bonnie, Kate and Jess said, please stay safe and don't forget to wash your hands.